Hello again. I'm Dr. Robin Saltz from Miami, Florida, and I'm here to talk to you about hypertension, better known as elevated blood pressure. A lot of people have high blood pressure in this country and worldwide, and I'll bet you don't even know what your blood pressure is at this very moment. That's because blood pressure changes with the wind, it seems. That's called labile or essential hypertension. Blood pressure can go up and down based on the simplest of factors. Could be high sodium in your diet, could be too much espresso, could just be plain good old stress. And who doesn't have that in this day and age? So very important to just monitor all these factors, talk to your doctor, and find out what the situation is with your blood pressure, because blood pressure can affect your risk for coronary artery disease, which is your risk of having a heart attack. And there are other factors that go into this revelation, not only high blood pressure. One of the other factors is just being male, just being a man. You have an increased chance of high blood pressure and a heart attack and coronary artery disease. Although now that women are working just like men and smoking and drinking like men, we're kind of catching up there. And that's an area that I don't want to catch up on. Another factor is your heredity. If your mom and dad had high blood pressure, chances are you will too. So genetics are just a huge, huge factor here. How many times have you seen a person that has been close to 100 years old and you question them more closely and you realize that they had a relative that lived to 102 or 104. So heredity is a big thing. The third thing would be having too much weight, being obese. And there's a very fine line between being overweight and obesity, but certainly when you are obese, that prevents the blood from going to different parts of your body, like your brain and your heart and the extremities, like your fingertips and your toes. And you certainly don't want to be at risk for something else, which is diabetes, by being overweight. So very important to keep an eye on that. And then lastly, stress. Stress is just something that you really can't put your finger on, but you know when you feel it, and that affects your blood pressure. It can also make your blood thicker, which is why a lot of people, once they approach middle age, their doctor recommends that they take things like baby aspirin, a coated aspirin, so you don't get an ulcer, and it will help your blood circulate and get the oxygen to your brain and the rest of your body that it's so needed. When it comes to the diet, you want to really keep an eye on the things that are high salt, things like Chinese food and delicatessen and pickles and olives and even canned soups, which is in everybody's household and just has a lot of sodium content in it. Caffeine, I mean, on every corner there's a shop to get coffee, and you want to keep an eye on that because caffeine can contribute to your blood vessels becoming more constricted, and that prohibits the blood from flowing where it needs to, and hence you would need a higher pressure to get the blood to go to those areas. Although decaffeinated products, not always the best thing, because the process by which the caffeine is leached out of the coffee bean is sometimes a little less savory than you would like. It could have some elements of toxicity. So if you have to have a caffeinated beverage, just kind of water it down and see how that goes. And then you want to also keep an eye on the medications when your doctor prescribes them to you, if you need to go as far as medications. And that would be the first line of defense against blood pressure is a diuretic or a water pill. That would make you urinate a little more, and that would get rid of your salt. That also gets rid of potassium. So sometimes people that are on diuretics, especially a higher dose diuretic, need to take foods that have potassium in them, like the white potato or a banana or orange juice. The second medication in their arsenal is usually a beta blocker. Beta blockers will slow your heart rate, which in turn decreases your blood pressure. Beta blockers will also prevent your heart from beating faster. So when you need your heart to beat a little faster, if you're running across the room or if you find you're getting aggravated, your body will compensate by becoming a little more winded or short of breath. So a lot of patients need to be informed about this before they're started on a beta blocker, and have it titrated up slowly or have it reduced slowly so the body does not have this type of discomfort. Then there are other medications, some called an angiotensin converting enzyme inhibitor. This medication is very effective, very good in diabetics, but will also give some patients a little dry cough. So if you find you're getting a cough on this medication, please let your doctor know. And then finally, we have the angiotensin receptor blockers, and we have the calcium channel blockers. These medications are great, but again, you have to make sure your doctor knows about the other medicines you're taking, even if they're from other physicians, as there could be some interaction, especially with the statin medications, which are good to lower your cholesterol, which is yet another factor contributing to blood pressure and coronary artery disease. So if it were up to me, I would definitely like a more natural approach like yoga and meditation to decrease my stress and improve my blood pressure. But I wish you well and calm and healthy futures. And this is Dr. Robin Saltz saying thank you for joining me.